I was resetting it. We're ready to go, Kevin. I'll bring the slide up for you.
All right. Well, good morning, everybody. Welcome to our December 7th, 2022 meeting of the Health and Wellness Advisory Committee for the City of Charleston. It's beginning to look a lot like Christmas out there, but it's been reported that Santa might be hanging out on Folly Beach with our 75 and sunny day. Got about 17 shopping days left, so you better watch out, better not cry, you better not pout. And I just want to tell you, thank you so much for each of you that's given us your time this morning and joining us during these busy holiday times. And we look forward to hearing from each of you this morning. So thank you very much. I guess I'll start off by making a motion that we accept the minutes for November 2nd, 2022 meeting. Will somebody please second that for me?
I'll second that.
All right, thank you. All in favor of approving the minutes, please say aye.
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 Any opposed? The minutes have been approved. Thank you very much. So our agenda is in a little bit different order this morning. I see Joey's on here now, so that's good. We're going to start with our community update and move that to the top of the agenda just to ensure that we cover, all of our needs of the community. And I'd like to start that off by calling on Joey Current to share an overview of the first data sharing of the 2022 Community Health Needs Assessment. So Joey, if you would, please.
Thank you so much for having me on today. Appreciate that. So for folks out there who aren't aware, we definitely have a group of health and wellness focused nonprofits and government partners and church groups that are part of a coalition serving Charleston, Dorchester, and Berkeley counties called Healthy TriCounty. And Healthy TriCounty provides and facilitates these groups getting together and focusing on various health topics and just trying to make our community a better place. And we focus on the topic areas that come up as the areas of highest priority in a survey that we conduct every 3 years. So we conduct a survey every 3 years. That survey is a joint effort between many of our partners in the coalition, but specifically I want to shout out Roper St. Francis for kind of leading that year after year. It's a really big effort, and we really appreciate y'all helping us out with that. So this survey goes out. It helps really guide kind of the work that we focus on. There are so many health areas that we could focus on in our community, but we want to take what the community says are their highest areas of need and focus on those. And so that survey just came back. We run it every 3 years, like I said. So 2019 was our last community health needs assessment. 2022 was the time for us to do it again. That survey data came back. And I want to share with folks that, the topic areas that rose to the top, those top 5 areas that we need to focus on in our community, that folks who answered the survey from across all 3 counties, various demographics, zip codes, those 5 areas of focus have not changed since 2019. So we're going to continue focusing on those things. Thank you so much, Paul, for pulling that up. So we have access to care, which is essentially transportation services to get to healthcare, and affordability, meaning being able to have health insurance of some kind. So we've bundled those two topics together into what we call access to care. There's been no change there. Clinical preventive services, those would be things like immunizations, cancer screenings, things of that note. Those actually moved up in the overall rankings, but still within those top 5. And certainly something we want to focus on and continue focusing on in our region. Oral health moved up, and we've put that in with access to care because, again, what we've noticed in the survey data was that oral health is very largely tied to just clinical services in general. And folks being able to have access to adequate oral health and oral health care is really important. But I will note that it did move up in the rankings from 2019. Mental health and behavioral health, or mental and behavioral health, right? So that's substance misuse and mental health concerns. Most of what we find in our survey data is that folks just aren't aware of what services are available and where they can go to access those services. Of course, there could be some bias in the data that comes back from survey data when we ask folks, what their perception of any kind of substance misuse services, right? Folks are sometimes hesitant to report on what they know about, what they don't know about in the community. But that has had no change from the 2019 survey. So that's still up there in our top 5. Obesity, nutrition, and physical activity. Most of what we saw in our most recent survey, again, highlights the fact that food access is really important for folks. Having adequate access to healthy fruits and vegetables in their community, and having places where they can utilize those benefits that they receive for folks who are receiving income-based supplements like the Supplemental Nutrition and Assistance Program, SNAP, you may have heard it called, or WIC, Women and Infant and Children supplements. So having more places where folks can utilize those benefits and just having more access to healthy fruits and vegetables overall is very important to folks. And we've noticed that that still is in our top 5. In addition to that, physical activity gets lumped in there as well. So we've asked folks, for instance, do you have places in your community where you feel safe going and running and walking and playing and being outside and moving your body? Or do you have safe routes to walk or bike to and from where you live to where you work? And so those are concerns that folks have. And we see that time and time again when we run this survey out in the community. So while it did move down slightly in the overall rankings, it's still in our top 5. Sexual health and maternal infant child health, those two. Sexual health actually moved up a substantial number, 4 spots. Before it wasn't even in our top 5. And we've noticed that in this most recent survey, it has come up as one of the major health priorities for folks to keep themselves and their family safe. So we're lumping that in with maternal infant child health because a lot of that goes hand in hand with providing folks with adequate services to be able to address their sexual health needs and also education and awareness around things like, a lot of the stuff that the city is already doing, which is great, and the Department of Health is already doing. So we're very happy to see that. I will also mention that health equity really sits in with each of these areas. So you'll see if anybody would like to have access to the raw data, we can get that packaged up and sent to folks for their use. But health equity is really woven in the midst of all of this, in that equitable access to these things and equitable availability of these services is a major concern to many of our community members who filled out this survey. And so one of our major priorities is not only to make sure that we are aware of what services are available to folks out in the community, educating folks on what they can gain access to, and expanding those services into areas where we see gaps and where we see deserts, essentially, for services that you see up there on the screen. So that's my big update for folks today. We will have a community health needs assessment official report that's in development right now. It will break down each of these areas, the data that we see, and we're of course going to continue focusing as we did in 2019 on these. What you see there is these 5 health areas. Once again, showing that our community needs may have shifted slightly, but for the most part, we're going to continue focusing on these 5 topic areas as a coalition. And we encourage folks to partner with us as we engage in kind of, awareness campaigns and various initiatives to try to improve access and expand services in these various areas across Dorchester, Berkeley, and Charleston counties. So thank you so much. I appreciate you having me on to share some of that new data.
Yeah, thank you, Joey. Appreciate all that work, and thank you for sharing that with us. Any questions for Joey? Joey, I know you said the city's doing some things here to help with some things, but is there anything more that you need from the city of Charleston?
I think the biggest thing that we would like for all of our municipalities to do is to, help partner with us. And the first thing is to, make sure that we have a good list of all the services that are available to folks and where those services are available. So if we can map that out, we can find out where those gaps are. And then we oftentimes look for folks to kind of jointly apply for various funding and other types of support that we can provide either through Trident United Way or through our various kind of health entities. So always looking for partnerships. If there's something that the city is interested in looking at and wanting to push in terms of an initiative, I encourage them to reach out to us so that we can help provide that referral service support and that mapping and kind of gap analysis.
Okay, great, thank you. Any other questions for Joey? Well, Joey, thank you again. Appreciate all your work on that. Thank you so much. And since we're kind of in our community updates, I'll kind of go around. Does anybody want to volunteer to give a community update, or kind of call on you? Meredith, anything from your group?
Oh, we're leaps and bounds. We're growing. We're excited about what's coming up for Charleston. We're excited about. I mean, we're kind of like a bittersweet moving out of the peninsula, but because we've been there for so long and been an integral part of downtown Charleston. But our new building, our new hospital, our new, I think we think the access is going to be easier for all of the Tri-County area. And a larger part of South Carolina that actually come to us for care. So we're very excited about where we're headed. We're very excited about the plans that are popping up. But all the different meetings, new things keep showing up of what we're going to be offering, what the hospital is going to entail, and how it's going to cooperate with the other 3 hospitals that are in the area now. So it's exciting. We're ready to show Charleston a whole new side and give a whole new, a brand new access to care and a lot more involved in the community. Even though we are already heavily involved, it's going to get better.
Great. Well, thank you. We'll certainly miss you being on the peninsula, but we wish you all the best with the move and everything. So thank you. Kimbo, anything with the Citadel?
No, not really on this end. We're just entering the final exam period, just like College of Charleston and Charleston Suburbs. So the program I was involved with, the Big Dog, Little Dog Family Run program, we're reaching the end of our training program, and we are culminating that with the Reindeer Run 5K downtown in Charleston this Saturday. So then are you out and about, you might see myself and a handful of kids and cadets with reindeer ears running around. So
all right, great. Well, thank you for that. Appreciate it. All right. Nick, anything from your group?
No, not really. Obviously, busy time of year at the moment. I mean, we saw Thanksgiving was an incredibly busy holiday period. We saw quite a significant spike and increase in food need just before the Thanksgiving. And obviously, as we go into the holiday period ahead of us as well, seeing obviously an increase in demand and need. So it's a busy time, not least with the holidays and things closing down over the holiday period. So we're just doing whatever we can at the moment to get the food out to where it needs to be, working very closely with our partner agencies who are doing an absolutely stellar job as well. But other than business as usual, we are seeing, as I said, an increase in spike, but it's the holiday period. But again, I think the impact of the cost inflation and the cost of food is obviously continuing to put pressure on a lot of households across our service area.
Well, thank you for all that you do. Appreciate that. Any questions for Nick on that? All right. Jennifer Roberts, anything?
Yes, good morning. I actually have good news today, which is happy to share. So The Department of Mental Health's been trying to get increases for our master's level clinicians so we can be more competitive. And finally, after a long year of waiting, our first round of increases went through. So we're hiring at this point, at least a 15% increase for new master's level clinicians coming out of school. So that will help us with recruitment efforts. And hopefully we're going to turn this ship around and get some of our staff back. Also like increases for the amount of increases we give for people that get licenses and for in social work or any kind of licenses really. So yeah, so it's really good stuff's happening with that. And I hope 2023 is going to be awesome. And because of that, it's interesting. Joey's report, I was sitting here writing things that all are related to Joey's report. We always, people don't know the services that are out there for us for mental health. And so we're going to do some kind of targeted commercials that you should see coming up in December and January. January's will probably focus more on suicide, and here's some services and people who to call. December's hopefully will be more on kind of recruitment efforts for us. So that's exciting. Our crisis stabilization unit that moved into the social services hub is there. It's not open yet because we're waiting on DHEC to come inspect us. And we're hoping to get it definitely reopened by January 3rd. We're going for a new license this time. It's not the same kind of license. So we're kind of, as far as that goes, starting from scratch. So it's going to take a little bit more time than just moving and reopening. But that's exciting and it looks great. And we're hoping to get that open first thing in January. We still do have walk-in access as far as mental health access. Just getting that word out that people can come to our clinics. It doesn't have to be an emergency. We will open your chart that day and hopefully soon have a lot more clinicians to help folks. Interesting, the sexual health thing on the survey. We actually have I can't remember her name. I was trying to get somebody to answer me in a text, but we have a sexual health speaker coming up this year for the conference. So that should be interesting and kind of on time with Joey's report. And I guess lastly, just an update on 988. I don't know if y'all saw it. I don't know if it was in our paper, but the actual whole system shut down across the country a few days ago, unfortunately. But we're still in the process of getting our building across the street from our Charlie Hall office to put the 988 and mobile crisis call centers in. But in the meantime, we kind of figured out a workaround to be able to help the 988 center up in Greenville because they're having staffing shortages too. So they're answering fewer calls than they were kind of before 988. So we're going to hire 5 staff and Greenville Mental Health Center is going to hire 5 staff, send them up to Greenville, get trained by Mental Health America, and then our people will come back and work remotely and we'll at least be able to help the original 988 center so we can answer more calls from South Carolina as we wait on our new building to be finished. And other than that, our nonprofit gave us $7,500 this year to put gift packages together for our adult patients. Mostly it's toiletries and things like that, but we're going to have lots of be able to serve probably 300 plus patients. And thanks to communities and schools again, we gave out about 150 Thanksgiving baskets with turkeys and all the sides. So lots going on at mental health, and it's the light at the end of the tunnel is here. And I was so happy the other night I had a board meeting and I got to finally end the year with good news and good things to come. So I have a great report and I'm in a great mood today because of that.
Great. Thank you so much. Appreciate all that you do and all that your group does. Any questions for Jennifer on that? Paul?
Just Jennifer, any of your information of when your locations and all, we'd be glad to get them posted over here at the city wherever we can to just make sure we can get that information out for you.
All right, thanks. And Joey, I'll catch up with you afterwards too to make sure that what y'all have is up to date.
All right, and I see Maggie Dangerfield's name on here. I don't see her face, but Maggie, do you have anything from Charleston County Schools that you want to share?
Good morning, Councilman Shealy. Thank you so much for letting us share a couple of things. Right now, this past week, we announced our COVID and flu testing clinic availability for all of our students, staff, and family members. There is a list of those locations and the dates and times on our website, but that service is available for free to our staff and students and their families, just as the season ramps up and we're seeing more cases of that across the area. Other than that, we are welcomed our new Board of Trustees members in the past couple of weeks after they were sworn in, and we had a board orientation session with them last week to give departments the opportunity to share all of the programs and initiatives and work that's in progress. And we look forward to closing out the year next week. We have an early release day on Friday, and then we will be closed, offices and schools, until January the 3rd. Teachers will come back and offices will reopen, and then we'll welcome back students on the 4th.
Very good. All right. Well, thank you for all that you do for Charleston County Schools. Appreciate that, all that work.
Yes, sir.
So I think we've been through everyone on our community updates. So it's HIV AIDS Awareness Month, and we have some people to talk with us. Dr. Richardson, Elizabeth McClendon with DHEC, and I know I'm going to get these names wrong, y'all. I'm sorry. Nakia Robinson and Nadia. I'm sorry. I'm going to get y'all to say it. I'm sorry, Nadia.
It's Klinsevich. It's not an easy one.
Okay. But thank you very much, all of you, for being on here and talking with us a little bit this morning. So I'll guess I'll turn it over to one of you, maybe Dr. Richardson.
Thank you, Councilman Shealy. I think Elizabeth McClendon is going to speak first. She is from our Division of STD, HIV, and Viral Hepatitis in Columbia, and she's going to sort of start us off by talking about the statewide Ending the Epidemics initiative, and then Nakia, Nadia, and I will discuss our more local efforts. So Elizabeth, the floor is yours.
Good morning, everyone. And first off, thank you for having Ending the Epidemics SC here and me. And after this is over, or after my portion is over, I'll have to excuse myself. The division is having a retreat today in Lexington County, but I'm delighted to be here. And just FYI, as a personal comment from the Midlands, I have been envious of Charleston's leadership. And so Councilman Shealy, thank you for having the Health and Wellness Advisory Council, for forming it. Thank y'all for asking Paul Wieters to be so deeply involved. And we are very jealous in the rest of the state and need your help in getting things more activated in Columbia and elsewhere throughout the state. So having said that, the Ending the Epidemics SC it's a grassroots organization which is not owned by DHEC, but the funding is currently from the federal government through an Ending the HIV Epidemic program. But Ending the Epidemics SC, notice the S on the end of epidemics. In 2017, Ali Mansouri, who is the director of DHEC's STD, HIV, and Viral Hepatitis Division, was at a national conference, heard about the concept of ending the epidemic, singular, which meant but didn't say HIV. He came back to South Carolina and at a statewide meeting in August of 2017, put an S. He had the vision to put an S on the end of epidemic to make it plural. And many people like Dr. Richardson and I and many others got excited about the concept of what a term y'all may have heard called syndemics, which pulls together different epidemics. And so we've started the Ending the Epidemics. It began in the fall of 2017. Dr. Richardson and I are still on the steering committee. I was not working for DHEC at the time. And the steering committee is comprised of people from all around the state in different walks of life. And roughly 25%, but don't quote me on that, are people who are living with HIV and a few who are in recovery from substance use issues. So Paul, would you advance it to the next slide? Now, actually, I have this memorized, so I don't need to read it. But our vision, which Dr. Richardson and I and others formed in early 2018, is a South Carolina free of new cases of HIV, STDs, viral hepatitis, and substance use disorders. And our motto is treat early, get tested. Sorry, stay safe. That one I haven't memorized quite well enough yet, clearly. Stay safe, get tested, treat early, and stigma. So next slide. And our purpose is with community engagement, because it's not just the steering committee, it's a whole statewide work group. But our purpose is to help the entire community of South Carolina, and we're still working on that, to become more aware of these issues of HIV, STDs, viral hepatitis, and substance use issues and the way they interact. And let's see, Jennifer, you had mentioned about mental health and the fact that you're going to have a sexual health speaker soon. I would love to know about that. And first off, thank you for doing so, for having a sexual health speaker come in, because all of these issues work together. And as DEODAS, who is a major partner in Ending the Epidemics SC, the Department of Alcohol and Other Drug Abuse Services, of course, as I'm sure y'all all know, they are definitely promoting the fact that that people who are using any kind of substance that impairs their judgment are more at prey for sexually transmitted infections. And I don't know the statistics well enough on the DEODAS side, but Linda Brown was just mentioning the other day that some incredible percentage of people who are meth users are getting infected at higher rates for multiple issues. So, and as you see on the screen, that we try to involve all stakeholders, not just people in the HIV and STD and substance use fields, but providers throughout the community, communities of faith. We involve rural and urban areas and are aspiring to having a true statewide effort and effect. So next slide. And then as you see here, we've got the work group, which is people throughout the state who are on a mailing list and who come together mostly for virtual meetings, but we're beginning to get back in to having some in-person meetings to help formulate the direction of where we're going with HIV. And this year, Katie, correct me if I'm wrong, but we had a summit on SUD in partnership with substance use issues with DEODAS. And then we also had several summits that were directed toward, at least one towards providers, and another, and of course the one in September towards the general public about substance use issues. And then the steering committee, as you see on the right, initially it was a very small group of Dr. Richardson, myself, and some others, but it has grown. I don't remember how many there are right now, but it's roughly 20. And it's got members of the HIV Planning Council, which is a statewide group, infectious disease physicians, people living with HIV, many community advocates, and that's sort of where I fall, and then prevention and care providers. And all 4 DHEC health regions are represented. So next slide. And then ending the HIV epidemic is specifically the area of the focus right now. And that's where the federal money is coming into South Carolina. there are 4 pillars of the Ending the HIV Epidemic program, and that's diagnose, treat, prevent, and respond. Next slide. And then the biggest thing we are fighting is stigma. And I don't want to spend too much time on this, but as somebody who has lived through the entire HIV epidemic, as I suspect some of y'all have as well, and you probably know that the HIV epidemic is 41 years old this year. And because the first diagnosed cases were published on June 5th of 1981. And even though, thank God Almighty, the medicines are phenomenal now, such that people living with HIV can live a long, healthy life. And if they're virally suppressed, and not even pass on HIV to other people through sexual activity. So there is so much good news. But the stigma, y'all, is as bad, in my opinion, and the opinion of many people, is as bad, if not worse, than it has ever been. And so we're still fighting that. And with Ending the Epidemics SC and with incredible partners like Charleston, we've got anti-stigma campaigns on our various social media platforms. We are happy to promote any that y'all are doing. We've got various programs, and again, are partnering with existing programs throughout the state to educate the community. And then, and we are, so I can't read, Paul, can you raise that slide a little bit? I've forgotten what, this is a slide that Felicia done. Oops, oh, well, that's okay. I think the last thing is ending or enhanced community education and messaging. So that's sort of encompassed in what I've said before. So next slide. And then just to recap, because I know I'm running out of time, the World AIDS Day, the Ending the Epidemics SC World AIDS Day 2022 was the 6th Ending the Epidemics SC World AIDS Day at the State House. Now, the actual World AIDS Days at the State House have been happening since the early 90s, so that's not new. But what is new is having it encompass more than just HIV, and that's where Ending the Epidemics SC comes in. And as you see, we've, because of COVID 2 years ago, and you can see my background is the U=U display that y'all now have. The one that's in this photograph is now down in Charleston. But you can see there is Ali Mansouri. This is a photograph I took on the State House steps in 2020. Because Dr. Linda Bell quite wisely did not allow us to have a big public event, but we had already had in the early days of the COVID epidemic, we had already had the State House reserved. So we went ahead and had a placeholder activity and began an online presence. So back to the slide you're looking at, you can see that we're online all day long. And we have always linked in for the last couple of years to the Facebook live stream of your Charleston World AIDS Day observance from 6 to 7. So thank y'all for doing that. It allows the entire state to participate in that wonderful observance that y'all been doing for years. And then on the right-hand side of this flyer, you can see that we were at the State House from 11 to 2. We had a data walk, storytelling, table displays, and of course, a phenomenally successful press conference this year and other activities. So if you, next slide, please. And then here, as you'll see in that little inset photograph, is a fabulous photograph of a still shot from the 30-second video that your own Shauna Hasty did, who works at DHEC in the Charleston area. So to encourage statewide participation, we put out for the 3rd year in a row, actually the 2nd year in a row, a challenge to have people across the state do 30-second videos. And one of the many that we got in and aired all day long on World AIDS Day on our social media was from Shauna Hasty. So please go to Ending the Epidemics. Remember that's plural, Ending the Epidemics SC on Facebook to the video section, the video library, and you can see all of the 30-second videos from this year and from last year. They apparently are also on Instagram and TikTok, and I don't speak either of those languages, but I am told that the videos are on those as well. So, and please, we encourage you to do more of these videos next year. Now, next slide. And now here are just a few photographs from this year's statewide event. And the statewide event, even though it's here in the Midlands, strives to be to represent and get statewide attention for HIV, STDs, viral hepatitis, and substance use disorders. And as you can see in the upper left, that's a still shot from an incredible WIS Channel 10 story about the event. And it's our debut. You can't really see the U=U off to the left, but it's there. But to the right, you can see the big Dare to Care banner that we premiered this year. And the same person who designed and built the U=U that y'all have designed and built the stand on which the Dare to Care, it's a modular stand, so it fits in my car, that the Dare to Care sign is on. And then you see a larger version of it with an ABC Columbia, a larger close-up of the Dare to Care sign below. So we're branding the State House event as a statewide event. And then moving to the middle of the slide, that's the south side of the State House. That's the sunnier and warmer side, where the tables we were 360 degrees around the State House itself this year. And as you see, there's a smaller version of the Dare to Care banner on that side. You can see it in both the upper and the lower photographs. And then you see a close-up of the U=U display at the very bottom. Then off to the right is what I am extremely proud of, and please take the time to read that proclamation later. It's a proclamation from Governor Henry McMaster. It's the 6th one in a row that he has been kind enough to approve and sign for us. And so, it compares, at all of you who are on this call, I think will be heartened by the various issues that that proclamation addresses. So thank you. And next slide. And then lastly, this is my next to the last slide. This one is the flyer that we handed out to the media that shows on the far left, the first page, it shows the rundown of the events that were at the State House. And then there's a QR code that takes you to a website, takes you to links that take you to various websites, including several from DHEC and from the CDC and the national U=U campaign. And then in the middle, you can see the walking trails, a map of the walking trails activity that we were promoting to promote physical activity to help strengthen our immune systems and make ourselves healthier overall. In the middle, you see a tiny little map of Trinity Episcopal Cathedral's grounds. They are immediately across Sumter Street on the east side of the State House. They held a healing service for HIV and other stigmatized issues. They held that at 12:30. And at the bottom of that page, you see the evening event that y'all were sponsoring there in Charleston. And lastly, over on the right-hand page, you see the press conference participants. And there were people from DHEC, from DEODIS. There were 3 or 4 people living with HIV. And the highlight was the Reconnect Us presentation from the South Carolina Department of Corrections with the program Reconnect Us, that is a reentry program for people living with HIV to either maintain their viral suppression or to help them achieve it by an easy transition into care around the state. And then you see the logos of our many different partners. And then the last slide is simply how to get a hold of Felicia, who is the head of the Ending the Epidemics initiative, and then my contact information. So are there any questions? And I have one for y'all when you're done.
Any questions, anyone? Well, thank you. And you said you have a question for us.
I sure do. And I'm going to direct it to you, sir.
Okay.
Paul Wieters, a year or so ago, was kind enough to offer to help Columbia get our Fast Track City initiative off the ground. We actually signed the initiative a couple of months before y'all did, but it's never gone anywhere. And so my question of you, Councilman, is would you authorize Paul to come up here one day? Because I think it's going to take a lunch to make this get off the ground. And we will figure out who will pay for that later. It won't be you guys, though. And just so y'all know, our Mayor Daniel Rickeman is incredibly supportive of the Fast Track City initiative and extremely impressed with all that y'all are doing in Charleston. But telling him that Paul is available to answer questions hasn't been enough to get something happening. So would you in the new year allow us to contact Paul and arrange with the Mayor of Columbia and a couple of the council people, if not the entire council, to meet for a lunch and have Paul make a presentation on all of the phenomenal things that y'all are doing, including this advisory committee?
Yeah, thank you for that invitation. And yes, I'm sure we have Mayor Tecklenburg on here as well. So I will also ask for his, but I'm sure we can certainly make that happen. So.
Oh, well, thank you so much. And I'm going to stay on for Katie's presentation and then I will jump off to my retreat. Thank you all. And again, as a South Carolinian, thank you for all that you're doing to integrate health awareness into the Charleston area. And lastly, I forgot to mention that one of your senators, state senators, Sandy Sen, from Dorchester and Charleston counties from District 41, she was one of our 2 sponsors of this year's State House event. So we are very appreciative.
Great. Well, thank you.
Thank you.
Yeah.
Thank you, Elizabeth. So we'll move on now to Nakia Robinson, who's our Tri-County Shade Director. She will begin and then Nadia will pick up and I'm sure I'll interject here and there. So Nakia, the floor is yours.
Good morning, everyone. Paul, by any chance, did you get my email of our presentation? I'm not sure if you were able to get it or not.
I do. I'm getting ready to pull it up.
Okay, awesome. Great. Good morning, everyone. Thank you for that introduction, Dr. Katie. So good morning. My name is Nakia Robinson. I am the Tri-County Shade Director for the Tri-County area, which we cover Charleston, Dorchester, and Berkeley counties, as well as the STD HIV health educator for DHEC here in the Low Country.
I'm getting it. You keep talking. I'll bring it up in just a second.
You're fine. So once again, I just want to thank you guys for giving us the opportunity to speak before you all today. We're going to be discussing some of the things that we are doing as SHAPE. What is SHAPE for those of you that may not be familiar with our organization, as well as the events that we've hosted, how we're impacting our communities, the things that we plan on doing in the future, as well as any other ideas and needs that we may ask at the end. But for starters, with SHADE, we are a sexual health collaborative. So we collaborate with other sexual health organizations within the area. So we're partnered with MUSC, as well as Ryan White Wellness Center through Roper St. Francis, Palmetto Community Care, Planned Parenthood, DHEC. And pretty much what we do is we like to collaborate with each other to advocate sexual health awareness, STI, HIV prevention, access to care, access to services, and resources. Also, as part of my role as the health educator for DEAG is to provide technical assistance to organizations who may need additional resources relating to sexual health, relating to STD and HIV prevention and education.
I've lost my share screen. I'm trying to find it real quick.
You're fine. So with our TriCounty Shape initiative, we are broken into sub work groups. So our first work group is our clinical and surveillance, which is run by our lovely Dr. Katie Richardson. And basically that's a meeting that we have every other month that allows all of the other providers and other care workers who deal with people who are HIV positive or at high risk of contracting HIV or any other STI, and we go over the data, the numbers, in regards to what everything is looking like in the moment of our counties and what we can do to kind of improve and kind of help. Also, that clinical and surveillance work group was also the ones that kind of front-running our Fast Track City initiative and front-running us becoming a Fast Track City here in Charleston. And then we also have our other work group, which is our communication and outreach, which is ran by Nadia as well. And we are the ones, that outreach work group is the ones that kind of run our Project Condom, run our World AIDS Day events, and all of our other community outreach events that we have operated through SHAPE as well, which later on Nadia will be able to kind of explain more what she does in regards to her role with TriCounty SHAPE as well. So we do a lot of work, but we do a lot of good work, and it's good. The reason why I love our SHAPE initiative is because we do get to collaborate with other work groups. We do get to collaborate with other organizations in regards to sexual health prevention and education, regarding to HIV prevention, as some of the things that I'll be talking about in a little bit. You know, we have our Fast Track City initiative, which we're focused on a certain number in relating to reaching our goals to ending the epidemic. So with our work group and with this collaborative, we're grateful that we are able to do this line of work in order to reach our goals to ultimately reduce the transmission of HIV infection as well as other STIs. So as I briefly stated about TriCounty Shade before, that we are a sexual health awareness, STI prevention and education collaborative that focus on the Tri-County area, Dorchester, Berkeley, and Charleston counties. Our mission, of course, is to reduce STI and HIV. To reduce STI and HIV transmission within our counties. We are also a nonprofit as well. So a lot of our work that we do through donations.
Do you see it?
Yeah, I can see it. Awesome. So this right here is our South Carolina HIV map. This is the most recent update that I currently have of our map, which was produced in April of this year. And as you can see that the color coded of the map is the number of people living with HIV and AIDS. And as you can see in Charleston area, we are deeply red. So we do have that roughly estimate between 1,700 and 3,100 people that are currently living with HIV. And then within the number, I don't know if you guys could probably see it very well, but within the number is the number of people who are currently not in care. And as of April, we had about 500 people who still need linkage to care services regarding to HIV treatment and prevention. So have done a lot of great work, but still got plenty more work that needs to be done for sure. Next slide, Paul.
I'm sorry.
No, you're fine.
Learning a new tool here.
You're fine.
You just keep talking. I'll find it.
Okay, awesome. So moving forward, we want to go ahead and talk about our fast track cities. So the fast track city initiative serves to provide support to priority cities during their HIV response. This began with the declaration in Paris to end the HIV/AIDS epidemic by 2030, and to also address any other disparities that or any other socioeconomic situations that can provide as a barrier to those who cannot receive those linkage to care services, and kind of negating those barriers so the access to care can be more realistic. And also in 2019, Mayor Tecklenburg, he did sign the declaration for Charleston to be officially a fast track city. So thank you so much, Mayor Tecklenburg, for being such a great support in Charleston being a fast track city and allowing us to really do this hard work in reducing the stigma and reducing HIV transmission. So with our targets for the fast track city, our target numbers is 95, 95, 95, meaning that we want 95% of people that get tested to be tested for HIV diagnosis and diagnosed. Out of those people, we also want 95% to be on antiretroviral medication. And out of those 95% of people, we want to be virally suppressed. So that's the 95 target that we're going with up into 2030. And so currently in Charleston, what we're looking like is that we currently have 85% people being diagnosed as HIV positive. So super close to that 95% mark with that. Out of those, we only have 67% that are actually currently on ART. So that's the part that we definitely need to do more work in, is getting those who are diagnosed into treatment. And out of those as well that are on ART, they are 88% suppressed. So that's amazing as well. That shows that they are adherent to their medications and their doctor's appointments. So that number is also very close to our 95% target goal as well. So the main focus that we are focusing on right now is getting those who are diagnosed with HIV into treatment and being on antiretrovirals so they can lead to that viral suppression. Going into that viral suppression, we have U equals U, which is undetectable equals untransmittable. So as you guys can see on March 2021, we had joined organizations relating to the U equals U campaign, which U equals U means undetectable equals untransmittable. So more than likely, if you are on antiretrovirals and you do not have a viral load that can be identified whenever they're getting blood work done, then the chances of them transmitting the HIV infection to a partner significantly decreases, which is what ultimately is what we want. We want people who are positive to be on medication so their viral loads are suppressed. And also, as you can see, World AIDS Day of 2020, we had the U equals U sign at the state capitol in Columbia. That is Dr. Ali Mansoure, who is our director of the STD, HIV, and Viral Hepatitis Division in Columbia, supporting the U equals U campaign. And then as well as the National Testing Day in 2021 in Charleston, we had the U equals U sign at the City Hall, once again with Mayor Tecklenburg. So the Future is You. So the Future is You is another collaborative that we have in regards to developing community partners to address stigma relating to STI, HIV, and promoting STI, HIV awareness and prevention. And with our not with our U equals U, but with our Future is You campaign, we're focusing more on the stigma relating to HIV, leaving what stigma that's surrounding HIV in the past, and letting people know that this is not what we've known it to be in the 80s. Like, science has come a long way. Education has come a very long way since then. And so just breaking down that stigma and just exposing more education relating to it. So one of the ways that we have done it in the past is we've had billboards last year, going into early this year, supporting the Future is You campaign. And then this year we had a social media campaign going through until I believe the 14th of this month, advertising for our Future Is You campaign and reducing the stigma, as well as increasing people to get tested.
Hey everyone, I'm going to be super brief because we are running low on time. But again, I'm Nadia Klinsevich. I work with Planned Parenthood. I'm the community health educator, but also the community outreach committee chair for SHAPE. So I have the pleasure of organizing and working closely with all our partnering organizations, trying to get things together for community events such as World AIDS Day. I'm going to throw some links in the chat so you can look later at kind of what all went down at World AIDS Day, but the first one is just a short Instagram that Palmetto Community Care produced, and then also a link to watch World AIDS Day. The ceremony was live streamed, and you can go back and watch that if you like. But it was a day dedicated to raising awareness of the AIDS pandemic caused by the spread of the HIV infection and mourning those who have died of the disease. And you can go to the next slide, please. We had a bunch of amazing events that day. We were able to do a Love and Learn where all the organizations set up tables to uplift the work that they do. We had a really powerful candlelit vigil through the cemetery at the Unitarian Church, as well as the ceremony who had speakers from College of Charleston, Palmetto Community Care, Ryan White Wellness, MUSC, Breath to Blossom. We had a sound bath. The theme was to remember to celebrate and rejuvenate. So we're celebrating all of the wonderful resources we have in Charleston and rejuvenate to continue the hard work that we do. So it was a place to gather, to show support, and show not only the resources that we have clinically, but also in community and solidarity. We can go to the next slide. So we also have a bunch of other events that we run as a coalition. For example, the Nailed It Community Chat event, which was a community-led event at the College of Charleston, where students were able to express sexual health needs for sexual health organizers. So we were able to learn what students need and what support we can give them, as well as Project Condom, which was a condom fashion show using dresses that are made entirely out of condoms. And that was community-based in downtown Charleston, where we're trying to kind of meet people where they are and make sure people get the education and the resources that we offer. And it's not just circling in the same communities over and over. We're really trying to increase our outreach. And Dr. Katie's going to touch really quickly on the community chat.
So we have some exciting things coming up in the new year. On January the 26th, we're going to have a virtual half-day event on the intersection of racism and HIV. We'll draw panelists from across our region, and we will make sure that you get that invitation and would love to have you join us. Later in February, we hope to have an all-day in-person interjurisdictional meeting with the Charleston Fast Track City and the Columbia Fast Track City coming together to discuss how we can collaborate to further reach our ending the epidemics goals. And obviously we will get in touch with you, Mayor Tecklenburg, and Paul to ensure that that is a date that we hope you'll be able to join us. And so I'll give it back to Nadia, but we will let you know more about those two events soon.
Thank you, Dr. Katie. So before I hit on the asks, I just want to give us an offer. I want you to offer up SHAPE's resources to you all. I know we have a lot of really wonderful people in this group and people that are willing to work with the College of Charleston, people that are working at the Citadel. If you all have ideas or things that you want us to bring to you, if SHAPE as a coalition cannot do it, we know exactly who can. So we work with everybody in the area that works with sexual health and wellness. So please, if you have ideas or things you want to see from us, contact us. And we also are asking the city for assistance in keeping this program running. So SHAPE is the best, works with the best and the brightest. It's the coalition that has the most collaborative work in Charleston. And it's the synergy that keeps our sexual health programs running. So something that could help keep this going would be monetary donations. We do not have any kind of budgeting right now. We are all working based on donations. So as you can see, we have our Venmo here, but also we would love to sit down with the city and discuss ways where we can get funding on a more long-term basis. Assistance with media and marketing, any kind of press releases or connections to social medias or news sources would be really helpful to uplift our events. and also space to hold community events would be really helpful from the city as well. But thank you all for listening. I have so much to share, but so little time. So I hope to speak with you all again, and I really appreciate your time.
Yeah, thank you very much to all of you. Dr. Richardson, do you have more? I'm sorry.
I don't have any more on this topic. I just want to thank Nadia, Nakia, and Elizabeth for joining us, and all of you for sticking around to hear this. I think it really dovetails, as Jennifer said, with what Joey started with, and the importance of collaboration, the importance of health equity, the importance of access to care and clinical preventive services. And so look forward to continuing to work with this group on that. And then I know it's 10, but I just want to finish up. There's Ali, our division director, saying hi as well. Thank you, Ali, for joining us. And I just want to end by saying I hope everyone has a very happy and safe holiday. If you've not gotten your flu vaccine and your fall COVID booster, now is the time. I'm particularly worried about our hospital systems, our children ages 4 and under, and our adults age 65 and over with respiratory infections, including COVID and flu this fall. And so please do what you can to protect yourself and our communities by getting your vaccines, making sure that you stay home when sick, practice good hand hygiene, and wear a mask if you're around those who may be more vulnerable. So thank you again. And Councilman Shirley, I'll turn it back over to you.
All right, thank you so much. I did want to point out that there was a couple of things in the chat that Nadia put in there. In case you didn't see it, she's got a couple of links there, and she has her email address, and said to please contact her if you need to. So if you want to see that, take a look. We'll leave that up a second. And I do congratulate Jennifer Roberts, who put in there that they passed their CARF, Commission of Accreditation of Rehabilitative Facilities, 3-year accreditation for her center again. So congratulations there as well. So anybody have anything else? Mayor Tecklenburg.
Yeah, I just wanted to thank everybody. Just listening and getting this update is kind of uplifting, everybody working together. Jennifer, that's great news. Joey, will work with you to update all the assets in the city that we know about, right, Paul? And I'd like to ask y'all to kind of think about a PR campaign to get that information out in the first of the year. Katie, do get with me on specifics of those meetings. Would love to participate, particularly connecting Charleston and Columbia, because anything that brings awareness, I think, helps the effort. I guess my only question was about what can we do to get that 67% going and up a little bit, and time short. So let us know if anything you think the city can do to help in that regard. But this whole committee is a valuable asset. This communication and focus on health in our community is terrific. Thank y'all for your participation this year. We're going to have a great 23, right, Jennifer?
Yes.
I'm just going to pick up on your optimism and enthusiasm for next year. And I know they moved the goalpost a little bit on us on the goals from 90 to 95%, right, with fast track cities, but that's all right. We'll get there. We were almost knocking on the door there on two of the three, but that's good. Goals ought to be stretch goals, and that I think we can get there, but that 67% obviously we need to work on. But the 500 people, right? It's just a matter of shaking them up to agree to go into treatment, right? Is there anything more to it than that, really?
I mean, essentially, right. It is people who know that they are positive but are not in care. And I think, again, this goes back to what Joey was saying, that I think we need to meet people where they are. We need to bring services to more folks in our community, whether that's mobile services or telehealth. It's working together across social determinants of health. Mental health needs to be involved. The Charleston Center needs to be involved. It's got to be a collaboration, and we've got to address the stigma, because so many of those out of care are not in care because of the stigma. So that's really where I feel like we can work together to say that HIV is no longer a death sentence. It is a chronic disease similar to diabetes, similar to depression, and it is one that, with care, people can live happy, healthy lives. Right. So I think that's our task.
Yeah, that was the message loud and clear at World AIDS Day event we had last week, was positive testimony about how much progress has been made, how treatment is effective and working. And that combined, I know you got to explain it, that U equals U message together with the advances that have been made in treatment is kind of like, why not get treatment? I mean,
yes,
exactly. All right. Well, God bless y'all. Have a great holiday season. We're going to have a great year in 23.
Yes.
And I just want to thank everybody's participation. Really do appreciate it.
Thank you, Mr. Mayor Paul.
Thank you, Mayor.
Thank you, Mayor.
Thank you.
Bye-bye, y'all.
I just wanted to remind everybody that Katie sent out an email to remind everybody that the health department will be moving in place on December the 14th up in North Charleston on Rivers Avenue at 3685 Rivers Avenue. So if you're looking for them, they're right around the corner.
That's right. So we'll be open on Wednesday again, and we're looking forward to the new facility. So come see us. I'll give you a tour. Thanks, everyone.
Well, thank you all very much. Happy holidays, Merry Christmas, Happy Hanukkah, and Happy New Year. We'll see you next year.